Parker. I'm sorry to all of the attendees for the little kerfuffle that we had at the beginning, but I think it's going to be smooth sailing from here on in. Thank you for joining us this evening for this town hall meeting. What we wanted to do is talk about a couple of different things. We want to give you some of the basics. We brought in some key county staff to do presentations on exactly where we are with things related to the ad hoc committees, of course related to the overall bigger picture of COVID-19. So I'll just tell you a little bit about what the purpose of the ad hoc committees were. The purpose of the ad hoc committee, these were formed by the Board of Supervisors about maybe a month after we had started the shelter in place within the COVID-19 situation. We determined that it would be a good idea if we as board members could have the opportunity to meet with some of the industries, the various industry leaders, to talk with them, to keep them apprised of what was going on, to be a link between the industries and the public health agency, and also to provide what the statewide guidelines were, to seek input from the industries and to provide local protocols on how the industries can implement the statewide guidelines. Tonight, we're going to be providing an opportunity for small businesses to listen to some of the leaders that we have in our community on this issue from within the county, and also to hear from you, to be able to have some of the questions that you may have answered. I'll tell you what we have as far as the ad hoc committees go. We have an ad hoc committee for construction, and we have an ad hoc committee for hospitality. For the ag industry, we also have one for religious organizations. And tonight, the ad hoc committee meeting that we're having is for non-emergency medical and personal services. And this is what we're going to be talking about this evening. And with that, I'll turn it over to Supervisor Parker to introduce our panelists and to hear their presentations. Thanks.
Thank you, Supervisor Adams. We will, I'm just really pleased that we have some really key county staff here tonight to help set the stage and answer any questions that people may have. We have Nick Chulos, who is an assistant county administrative officer. He doesn't have an explicit speaking role, but he's been involved with so many aspects of this entire process of preparation that if any of the rest of us are stumped, he can chime in. Our first speaker this evening is going to be Les Gerard. He is our county counsel. He's going to talk a little bit about give a little history of the shelter in place. He's going to talk about the role of the public health officer and kind of set us up with a statement of kind of where we are today in terms of the shelter in place order, what's being relaxed, what's still in place. And then once he finishes, I think he is going to have to leave. So I think we may see if anyone has questions, if you would put those in the chat or in the question and answer, we'll see if we can ask him any of the questions that you may have where he might need to answer. And then once he is done, we will hear from Elsa Jimenez, who is the director of our health department. She and her staff have been up to their eyeballs ever since early March, tracking the situation, putting preparations in place, getting data out to the community. And she is going to pick up where County Council leaves off, and she may give us an idea of where we are with some of the health considerations, but she will really walk us through what is allowed now, what isn't, and then we'll get into kind of what you all may need to do in order to be prepared when it comes time for personal services to open. So I'm going to turn it over to Les Gerard now, and we have some slides to sort of guide the conversation. Take it away, Mr. Gerard.
Thank you very much, Supervisors. Good evening, everybody. It's a pleasure to be here, and I am here for the long run. Whatever conflict I may have had evaporated, so I'll be here for the duration. So just a little bit of information on what is the role of the public health officer. Specifically in this instance, they have somewhat unique authority in the law. They can order closures of businesses and public places. They can order isolation or quarantine of individuals. And specifically with respect to communicable diseases, this is where this authority comes into play. Most of you may be familiar with tuberculosis and other more well-known communicable diseases, and that's where the role of the health officer really comes into play most of the time. What we have here is a new communicable disease, which the state has added to its list of communicable diseases. So you can see the Health and Safety Code section on the screen. That gives the health officer certain power. If the health officer knows or has reason to know that there's a case of a disease reportable by the state existing or recently existing within his or her territory, the health officer shall take measures as may be necessary to prevent the spread of the disease or occurrence of additional cases. It's also important to remember that there's a state public health officer, and then there are local health officers. And Dr. Moreno is our local health officer, but there's a state public health officer also, and I'll get to that in just a minute. So it's also important to remember that the Board of Supervisors cannot direct Dr. Moreno with respect to his public health duties. So Dr. Moreno has issued a series of shelter-in-place orders, and the Board of Supervisors cannot override those orders. So it's also important to remember and know that Dr. Moreno is coordinating closely with our regional hospitals, Salinas Valley Memorial, CHOMP, certainly Natividad, and Me Memorial in South County, and is also coordinating very closely with the surrounding counties, Santa Cruz, San Benito, the Bay Area counties, San Luis Obispo, and also important contacts at the state level. So let me give a little history, if you go to the next slide, give a little history of the shelter-in-place orders here in Monterey County. So in late 2019, you might recall that the coronavirus emerged in China. The virus was first detected in the United States up in the Northwest, I believe, Seattle area, Washington, around January 20th. The coronavirus is a virus, and it causes an illness that is named COVID-19. So those two terms are pretty much interchangeable. They relate to the same thing. COVID-19 has been determined to be highly contagious, and it is potentially deadly, especially to people with underlying health conditions. On March 17th, Dr. Moreno issued his first shelter-in-place order. This was pretty much simultaneous with the issuance of shelter-in-place orders by 7 counties in the Bay Area that were taking the lead on a response to the potential pandemic. The counties were aware that the state public health officer was contemplating ordering all Californians to stay at home except as needed for essential services. Next slide, please. So on March 17th, Dr. Moreno issued his first shelter-in-place order that basically allowed what were then called essential businesses only to open and allowed travel only in support of the essential businesses. The state public health officer and the governor issued their own orders on March 17th, is basically ordering all citizens in California to stay at home. So when you hear the term shelter in place, that's the local order. If you hear the term stay at home, that is the state's order. And it's important to know that the state has this overarching order in addition to the shelter in place order. So the second shelter in place order was issued on April 3rd. It added additional restrictions and made clarifications. On May 1st, the third order was issued that lifted certain restrictions and allowed some additional activities. On May 4th, the governor issued an executive order that announced the 4 stages to reopen California. We were at the time in stage 1, and he talked about the ability to move in stage 2 and then beyond that. On May 7th, the state public health officer issued an order that announced what was called the roadmap to recovery and indicated that the counties could move into early stage 2 and that certain businesses could reopen on a statewide basis. On May 8th, Dr. Moreno issued a supplement to the third shelter-in-place order that allowed the county to move into early stage 2 and allow some businesses to operate on a very limited basis. On May 30th, Dr. Moreno issued his 4th shelter-in-place order, which basically said, we are going to follow whatever the state allows to be open. And if we were allowed to move further into stage 2, we could do so if what is called the attestation was accepted and posted by the State Department of Public Health. Next slide, please. Thank you. So the attestation was posted and we were allowed to move further into stage 2 with additional businesses being open. On June 5th, the California Department of Public Health issued new guidance for additional sectors, but indicated that the local health officer had to make a finding that the county met certain criteria in order for those additional sectors to open, utilizing the new guidance from the state level. So on June 7th, Dr. Moreno made that announcement effective June 12th. So beginning tomorrow, certain businesses can reopen. Perhaps the big one is dining in at restaurants rather than having to sit outside or take takeaway. There have been a few other related orders over the course of time. Dr. Moreno issued an order requiring facial coverings if you're outside your house. He also issued an order regarding short-term lodging that he actually just rescinded today because the state has issued guidance for hotels, motels, and other short-term lodging. So that one is no longer in effect, but the facial covering order still applies to being outside your household. So that's
yes. Sorry to interrupt, Les. Is there a way that you can move closer to the microphone or increase the volume? Some people are finding your dulcet tones to be too faint.
Well, I'm sorry about that. I thought I was speaking up, so I moved a little bit closer. If anybody needs me to repeat what I was talking about, I'm happy to do so. But that's the end of my presentation. I'm happy to answer any questions now or later.
Thank you. I do see that there is a question. Someone is wanting to know if how the face covering order aligns with the state's orders for opening. The question is, so if we align with the state's orders, do we not have to wear masks due to the county ordinance?
We do. The facial covering order applies independently of whatever guidance the state issues with respect to businesses. So Dr. Moreno has kept that order in place, so it is still applicable in Monterey County.
That's great. Thank you. Any other questions for Mr. Gerard at this point? There may be other questions that come up that he can chime in on. Thank you so much for kind of setting the stage, and I'll turn it over now to Ms. Jimenez, our Director of Health.
Thank you for that. I'm happy to report that Ms. Nava is now able to hear the interpreter. So yay, we figured that one out. So I'll just carry it forward. You know, on May 4th, our governor unveiled his plan for state reopening, which is referred to as California's Roadmap to Recovery. I was clearly articulated that we would be reopening California in 4 phases or stages, really with the premise of how could we continue to create low-risk environments while balancing the need to make sure that we reopened additional sectors to get people back into the workplace and provide additional services to our residents. So stage 1 was where all Californian counties were at, really where we reopened essential workplaces and really tried to make any modifications we needed to make those essential workplaces as safe as possible for the employees, as well as the customers or patients or clients that would be accessing to. As Les indicated, you know, stage 2 was launched, early stage 2 was launched on May 7th. And this is where, again, the list of essential services were expanded to include schools with modifications, full service car washes, construction, etc. And really where we are right now is what we are calling early stage 3. So this is where we are looking at higher risk workplaces and really identifying what are the changes that need to be made at those workplaces to allow them to reopen safely. Again, with the focus, and I'm going to keep saying this, on keeping their employees and the public that is accessing their service. And so this infographic shows where we were towards the end of May. As Les indicated, a variance through an attestation was made possible, and we submitted ours, which was then posted on May 30th. And that really allowed dine-in restaurants, hair salons, and barbershops to open. And very recently, as of June 5th, last Friday, the state issued additional guidance in some personal service areas, you know, wineries, etc., that I can get to at the very end. But this is kind of where we were at the end of May in terms of businesses that were allowed to reopen. Next slide. As was indicated, it was not just a matter of saying we want to reopen. There are readiness criteria and indicators that the county had to put forward. And I won't go through each of these, but I will tell you that from our health officer perspective, the most important ones for us to monitor closely every day to determine if maybe we need to scale back our reopening strategies are ability to be able to maintain hospital capacity and have that capacity in case a surge were to come in our county, and also our ability as a county to be able to protect our vulnerable populations. You know, we know that individuals over the age of 65 or those that have health complications or immunocompromised are at greater risk of developing complications if they were to be infected with COVID-19. So those are really the 2 indicators that as a county we are looking to see if we need to scale back. Every day we are reviewing all of these indicators. They are now posted on our Health Department COVID-19 webpage so that you can begin to track. This is just another listing, more detailed of these triggers. And as I mentioned, one that we're really watching very closely is the surge capacity for the hospitals and our healthcare systems. Along with the vulnerable populations is the availability of PPE, and do all of our skilled nursing facilities have at least 14 days or more of PPE available? Again, they are a business in our community that houses some of our more vulnerable residents. Next slide. So Les kind of covered this, the shelter-in-place order that became effective May 30th. I talked a little bit about which sectors were able to reopen at that time, which was dine-in restaurants for both indoor seating as well as outdoor seating, again, with extreme modifications in terms of the number of individuals that could access that service, the requirement for all staff to wear face coverings at all times, for clients or patrons of those facilities to wear face coverings when they were not consuming food or drinking liquids, as well as the hair salons and barbershops. One client at a time, both the receiver of services and the barber or the hairstylist need to wear a face covering during the duration of the process. Next. So as I mentioned, we're in early stage 3, And since we aligned our health officer order with the state, meaning as the state releases new guidance for new sectors, and our data is still favorable, meaning that we still have sufficient capacity to address any surge and that our vulnerable populations are still protected, Dr. Moreno may determine whether or not we want to implement any of those new guidances in our jurisdiction. So tomorrow really marks a day, and hopefully the public is somewhat aware. On Sunday, we did release a press release indicating that Dr. Moreno was going to advance with the state into this early stage 3, and that all of the guidances that were released last Friday, those sectors would be able to reopen tomorrow. So this is an infographic that should be on our website now. If not, it will be later today. That really highlights all of the items in yellow or gold are what is currently open in stage 1 and stage 2, or what will be open in early stage 3. And again, this is with variants. Early stage 3 is only available to those 47 counties or so across the state that have submitted an attestation and have a variance. So this is where now we provide an opportunity for families to be able to engage in entertainment outside of their home by being able to go to the movies, to local bowling alleys. So should those businesses choose to reopen, you know, our wine bars, our wineries and our bars are now able to resume services, whether they are independent operations or part of a restaurant facility or a hotel. You know, Monterey Zoo is now able to reopen with modifications starting tomorrow, as well as any and all of our indoor museums. Our gyms and fitness centers, our yoga studios, etc., could reopen, you know, with modifications, fewer individuals partaking in the activities, you know, staff training, making sure that there is disinfection of materials and supplies that may be used by individuals as they're accessing those businesses. You know, hotels and lodging for tourism, this is a big one across California, but also for our Monterey County, as this is one of our biggest industries. And so now our area hotels, short-term rentals, et cetera, and other lodging facilities are able to open up their doors for residents, as well as individuals that may want to come visit our beautiful Monterey County. Card rooms, and then another big one for our area, considering some of the state and privately owned campgrounds and RV camping that we have in our county are now able to open up. Another thing that I know that we had been getting a lot of requests from was our, you know, ability to be able to open public pools, so whether they were a community pool in a residential complex or whether they were pools associated with the city parks and rec. And now all pools are able to reopen, and our Environmental Health Bureau is developing clear guidance for that and working with all those individuals that do have pools and are permitted by environmental health to be able to open. In gray indicate those sectors that are yet still not open, able to open. We know that the state has heard loud and clear from counties with respect to making sure that there are guidance for youth to be able to form their organized sports, whether it be little league, softball, soccer, etc. That is something that is not yet permitted, and the state is working on guidance, as well as a whole array of other personal services, as nail salons, spas, massage parlors, tattoo parlors, etc. So those are things that the governor and his office are working on developing guidance so that at some point in the near future, they may be permitted to reopen. And then of course, lastly, are all those very high risk where a lot of individuals from different parts of this, you know, county, state may come together to watch a basketball, you know, professional basketball game, or come together to be able to listen to a concert or convene individuals for a conference or convention. Those sectors are what's going to be open last, and that is really an indication at what point we in California are ready to, you know, end our stay-at-home orders, and we can permit individuals from different parts of the county and state, et cetera, to come together and convene. Next slide. Can I get the next slide? So we're very fortunate that the state is developing this guidance. So this really creates a less work for us at the local level in terms of having to draft guidance, and also then may create some inconsistencies between local guidance and state guidance. So we are referring all of our sectors to follow state guidance and are happy to review any questions that they may have or any deviations that they want to have considered from that state guidance. We don't require individuals to submit their site-specific or business-specific plan for review or approval. We just expect that everybody will abide with the state guidance and put their protocols in place, make sure they have the appropriate signage, the appropriate physical indicators to show a 6-foot distance, that their staff is trained, etc. And we're always happy to answer any questions that any member of the public may have by calling the number on the screen. So these are the 5 critical areas that each business that is considering to reopen must develop for each of their facilities. You know, conducting a detailed risk assessment, developing a site-specific protection plan, and I won't read the rest. And again, we are just, you know, we are hoping that the businesses, if they are ready to reopen, it's because they've met these 5 key areas that need to be implemented and put in place before they can allow the public and their staff to access their facility again. And I will just end with this, that I think there are a few things that we want to make sure we remember. Just because we are reopening California, reopening Monterey County, does not mean that the virus is all of a sudden gone away, or that it is any less virulent for our residents. But it is that balancing act between trying to create a new normal and while at the same time really preserving public health. So these are the things that we want to make sure that everybody remembers as we increase our movement across the county and potentially outside of our county. As was indicated earlier, because our health officer has issued a face covering order, when we are out in public, we are expected to wear a face covering order. If we are over the age of 12, anybody under the age of 12 is not required to, or anybody who is not able to because of a medical reason. We need to make sure that not only we're wearing our face covering, but that we are keeping a 6-foot distance between ourselves and anybody else that is outside of our household unit. Washing our hands frequently, you know, that prevents not only COVID, but so many other viruses and infections that we could get. So making sure we're washing our hands frequently or using hand sanitizer if we don't have access to soap and water. If you are not feeling well, if you are experiencing new symptoms, you're not your norm, please stay home. That is the best thing you can do for yourself and the best thing that you can do for your family and individuals that you may interact with while you are out conducting your business. And please, just because now every restaurant is open for dine-in service, you can go get your haircut, etc. There's no reason for you to go visit every dine-in restaurant that you enjoyed a meal and haven't had in a couple of months. Space your trips out, plan accordingly, and try to limit your interaction outside of your home or outside of your workplace. And I'm happy to take any questions that the group may have.
Thank you so much, Elsa. That was a really very thorough and comprehensive presentation. I'm just scanning through some of the questions, and I see there are a number of questions asked about massage, which I will ask you. But before I do, a question that has been posed to me a number of times is, must we as a county follow the state's guidelines? Could we go ahead of the state, or must we wait until the governor determines that we're going to phase 3.5, so to speak, before we can go?
Most definitely, we are not permitted to advance through the stages at a more rapid pace than the state of California is advancing. So as new guidance is released, our health officer and team will be looking at all of our indicators and data and then determining if we should progress along with the state. So we can progress at the level of the state, but cannot advance ahead of them.
Okay, so one of the questions that we have, again, is when can massage therapists open? This particular person does not have employees or walk-in clients. She feels she or he feels it should not be treated as a spa. And the clients usually have a medical referral.
So that question has come up a lot across health official conversations and with the state. Massages or massage parlors are included in other personal services that are yet to be open. They do make the distinction that has been brought up as to why chiropractors are able to reopen and provide potentially a similar service. And chiropractors are included in the healthcare professions arena and therefore are considered essential workers, as where massage therapists are not. And unfortunately, we have to wait until the state issues guidance for that specific sector to reopen.
And then a follow-up to that question, are medical spas allowed to be open to be doing regular treatments like Botox or dermal fillers, that sort of thing?
So I know that some providers who perform Botox are licensed nurses, physicians, etc. And so as part of healthcare professions, I believe they are permitted to be reopened. Now, if they are part of a spa business, I don't know. I'd have to get back to you on that.
Okay. And then I'll take one more. I'll give one more, and then I'll turn it over to my colleague, Ms. Parker, to ask a few questions as well. But so Elsa, the question is, will the health department be making regular visits to ensure that the safety protocols are being followed?
So for those businesses that are permitted through our Environmental Health Bureau, as new guidance is issued, we make a visit. We send information to those businesses. We educate them about what the requirements are. We answer any questions that they may have, and then they're allowed to reopen. Going forward, we would only respond through a complaint basis, or as time permits, we may be doing spot checks. This is really going to be a responsibility on all of us as members of the public to really self-monitor and make sure that businesses who are reopening are doing everything that is required of them to keep their staff safe, as well as any patrons or clients that may be participating. We do have a consumer line or complaint process through our district attorney, where individuals could file complaints if they believe that a business is not following guidance, or local law enforcement could also be sought out. And I see Les wanting to chime in, so.
I was just going to comment about the DA's ability to prosecute for unfair business practices for a business that is not supposed to be open. They've actually investigated a number of instances in the past about that, and I think they've had a good effect in getting compliance. So that's all I was going to say.
Thank you. There's some really good questions coming in, and maybe just to give Ms. Jimenez a break, maybe Mr. Gerard, you could speak to the question that is being raised over and over. Why are hair salons open and nail salons aren't? They have a lot of the similar protocols, and there are a lot of questions too about why not tattoo parlors? They know everything about keeping things clean. So there's a question of why them and not us, but then also a lot of questions about whether we know when these other personal services, what's the timeline for them being able to open? Anything you can add there?
I'll do my best, Supervisor. I cannot answer why, and I'm not sure that Ms. Jimenez can answer why hair salons and barbershops were allowed to open earlier than nail salons and tattoo parlors and the like. Those determinations have been made at the state level. And as Ms. Jimenez said earlier, we cannot be more liberal than the state, or the state is going to come down hard on us and maybe force us to retreat from where we are. So I would urge any businesses that have a statewide association, talk to your statewide association and go lobby Sacramento. My personal opinion is that's why a lot of this is happening, is that statewide associations have been in the governor's ear. who's been in the state public health officer's ear about the need to reopen business sectors. I'm sorry, the second part of the question, Supervisor, was
well, it was really what's the timeline?
timeline.
And I think
I think Elsa might have a better idea than I on that. I know she did mention that the state Department of Public Health is actively considering guidance on a daily basis. So hopefully it's soon, but Elsa may have a better response than I.
Yeah, unfortunately, I do not have a better response than that, other than the state is working actively on developing guidance for all of the sectors that are yet to be reopened. And they say soon. Soon could be a week, a month. You know, I don't have a clearer timeline.
I think, Elsa, probably most of the people who are listening and participating have an idea of the basics of what they need to do. But if you don't mind, or whoever's got the slides, if you could go back to those essential points. There are people who are participating by phone who may not have been able to see those. And I think it would be good to just reiterate. And then also, I guess a question is, would it be your opinion that some of the specifics, the specific guidance that a lot of personal services will have to follow would be similar to hair salons, so that they could go to the state guidance for barbershops and hair salons and just make sure that they're taking some of those specific steps that could apply to them? I'm trying to just give people a sense. It's so frustrating to have this illogical reopening pattern, apparently. And so rather than focus on why it doesn't make sense, really focusing on, well, what can people be doing right now? They may be very close already, but just making sure that they are as ready as they can possibly be, so that when the state says, okay, go, they can turn right around and not miss a beat.
If you were to look at just 2 or 3 different state guidance, you will see that the shell of it is essentially the same with respect to making sure that the business for every facility, it's not just for your business, but at every facility, you need to make sure that you conduct a detailed risk assessment and implement a site-specific protection plan. So this is with respect to, you know, flow of individuals through that operation, you know, key indicators that you need to make with respect to keeping 6 feet away, really making sure what are those modifications you need to make to keep your employees and your patrons safe. Our employees are our biggest asset, and so we need to make sure that they understand what COVID is, how to prevent the spread of it or limit the spread of it, you know, how they should be screening themselves every day before they enter the workplace, or what to expect when they come to the workplace with respect to, you know, any temperature monitoring that the facility is going to require, and or symptom monitoring. So these are all really important topics and somewhat knowledge base that all of our employees need to have. Some facilities may be implementing a required symptom and or temperature monitoring of clients or patrons before they enter the facility. So an individual needs to be able to be trained to be able to do that, and be able to, you know, look at somebody and maybe make a determination or ask further questions if they feel that somebody may not be feeling well. They need to be trained on how to wear appropriately a face covering, when to wear gloves, not wear gloves, etc. And I kind of talked a little bit about individual control measures and screenings. This is where our clients and patrons may have to be symptom monitored or have their temperature checked, or both, depending on what the facility's plan is. Disinfecting is a critical element, and this is where you will potentially see deviations from one sector to another. So for example, at a gym, you know, there's going to be a requirement that every barbell or other equipment that is used is clearly and effectively disinfected after every use before another individual goes and uses it. If you have a restaurant, This is where you're going to have to make sure that you disinfect the table, the chairs, etc., any other high touch surfaces in that facility. So this is where there might be some deviations depending on the type of service that you are developing. And then, 6 feet. We can't speak enough about the importance of maintaining a 6-foot distance between yourself and somebody else. Having a plexiglass partition in front of you, wearing your face covering, that is not good enough. You have to make sure that you have your face covering and are at least 6 feet away from somebody else that's not in your household. So this is, where they have to station, how the chairs in the lobby, going back to the specific thing. I mean, there's a lot of modifications that have to be done to the physical environment within the facility to make sure that you don't create opportunities for individuals from separate household units to come together while they are there accessing services that you may be delivering. So I would say that yes, for a lot of the personal services, you could look at the barbershop and hair salon guidance to begin to think about what are those modifications that you're going to have to make in your facility to make sure that you are ready to reopen once the state issues guidance.
I saw as well that someone had put up a posting that the Centers for Disease Control has a series of protocols for the nail salons. And my expectation is that's a great place for people to look, not just for nail salons, but also for the tattoo parlors and for any kind of a massage therapy as well, for people to be able to look at that. I have another question that is an interesting one to me because I'm not sure how you would answer it, but we'll give it a try. When is a jiu-jitsu gym expected to be able to open? And what phase would they fall under when it involves grappling and wrestling? How about that?
I'll take a quick shot at that. It involves physical contact. And so what is allowed to be open now is non-contact martial arts. So if there's physical contact involved, that's going to be a little bit later in the stage. And I don't think we have any idea about when that's going to happen. If I could go back and to the previous topic though, and just add, if you look at the guidance from the state for particular business sectors, there's also usually a checklist for the business that you can open up and see what the state is going to require you to do. And one of those things is each business has to post the protocols for the customers that come in so that they know what they have to follow. And one of the common questions we get these days is, well, what if my customer isn't following the rules? And businesses need to understand they can refuse to do business with somebody who is not following the protocol, not wearing the facial covering, refusing to keep social distancing. So that's something that as businesses reopen, they need to remember that that they have the authority to do.
Someone asked a question of whether or not dog parks are open.
Dog parks are not open. The problem with dog parks is the social distancing. The dogs carry the virus. They can transmit it, and the dogs are going to socialize, and the owners are going to have to socialize with them. So right now, dog parks are not open.
Thank you.
Would you speak, maybe Ms. Jimenez, there's a lot of concern about, people from our area going to places where there may be higher infection rates, or people coming, now that things are opening up, people coming from places where there's a higher transmission rate, and the possibility of all of this increasing the COVID positive rates in our area. And could you speak to the messaging that we plan to do? How do we plan to get the message out to tourists, even to our own residents, about how important it is to continue to wear the face coverings, keep that physical distance, keep washing your hands, don't go out if you don't have to? How are we going to really make sure that that message is being heard far and wide and repeatedly enough that people might hear it and adhere to it?
Yes, definitely. With the guidelines for hotels and lodging to reopen for tourism, it really is very concerning for a lot of counties, because now not only do we have the community spread that we have amongst our own residents, but we could potentially have asymptomatic individuals from other parts of the state, nation, even the world, to be frank, who will be entering our county and may not have the same rules in their jurisdiction with respect to face coverings, or they may come from a part where they may not have any restrictions. And so this is going to be very important for the county to continue to work through its ad hoc group for hospitality services, where there have been a lot of thoughtful discussions and conversations regarding, what the hotels are going to be able to do and will do to help increase awareness amongst their visitors about the importance of wearing a face covering when they're out and about the importance of washing hands, hand sanitizing, etc. We did bring on a marketing firm through contract with the county that is going to be or has been working with this industry and developing marketing materials. And maybe Nick could speak a little bit more to this, but this is really going to be, kind of a community intervention to make sure that as people come to escape the heat or whatever, come to our beautiful bay, that we make sure that they are here safely and protecting themselves and protecting the residents. So I'll hand it off to Mr. Chulos.
Yeah, thank you, Elsa. Yes, just to comment briefly on that. Yes, we have a marketing firm that we brought on board to help augment our messaging that we've already been doing. We know from discussions we've had with the Visitor and Convention Bureau and the Hospitality Association that they are preparing some very aggressive public information materials that would go to visitors. We're looking at targeting visitors on our own in terms of messaging about proper health practices. If you come to visit, we'd love to have you come and visit, but we really need you to adhere to the health guidance. So that's going to be messaged out through print, radio, reaching into markets where visitors would originate that might come to visit our area. So just to agree with Elsa, it's a big concern, and we're going to do everything we can to message as aggressively as we can to try to put the word out to the visitor sector.
Thank you. And just one more question before I turn it back over to Supervisor Adams. There are a lot of questions about pools. When do pools open? What about jacuzzis? What about hot tubs? What's the thinking there?
So at this point, all pools in Monterey County are able to reopen tomorrow. There are specific requirements that need to be abided by, whether it be a residential complex or a county parks and rec department that has a public pool, or it's a private community pool, or it's a pool tied to a gym or athletic club. So pools are allowed to reopen with significant modifications to the usage of those pools by the patrons.
How about dance studios?
So this is where, if you look at the gym and fitness center guidance that there are, there may be an opportunity to reopen with much smaller group sizes, creating cohorting. So there could be that opportunity. Now, granted, it may not make sense for an operator to reopen because they'd have to limit their class size to 12, for example. And so those are the considerations that business owners need to look at and take into consideration if they're going to be able to be fully functional, considering all of the restrictions with respect to the number of individuals that can partake. And it would have to be the same instructor, the same group of individuals, the same 12 ballet dancers, for example, with the same instructor that would have to form a cohort, and no new members could join that group. Again, to create a group in case there is any spread, it's easier for us to be able to do contact tracing amongst that group.
And there have been several questions related to this, in that why are gyms allowed to open, but outdoor youth sports cannot, when children are much less likely to catch the virus, especially when they're outside?
So that is, again, as Les articulated earlier, when we look at, the environment, are there opportunities to create lower risk in those environments? Some of the decisions being made don't make sense to us. But having said that, there are day camp guidance that could be followed if they do want to form a smaller group to be able to recreate outside. Unfortunately, like our American Youth Soccer Association leagues, those are yet not permitted to reopen.
And I'll just throw another one out. How about outdoor Tai Chi?
So again,
Is that non-contact or is it contact? I think it's non-contact.
It's almost like dance moves.
Right. So that would be allowed, but again, subject to what Elsa talked about the size of the group, the single instructor, et cetera.
Very good. And then this is a question that is not related necessarily to business, but it's a question I think people want to know about. And then what are the plans if there is an increase or a significant spike in COVID-19 here? How do we go back to the early phases? Or do we go back to the early phases? And is that determination made at the state or the county level?
So the determination is initially at the local level. If the state is not satisfied with our response based on our metrics, the state public health officer can intervene. I'll let Elsa talk about, what the triggers are and what we might do.
So there are a variety of indicators that we are tracking every day. And I'll just reiterate, in terms of at what point will we make a determination that maybe we need to slow down and not reopen new sectors that the state may be releasing guidance for, or if we need to scale back what's been reopened in our county, are really two. Our ability to protect our vulnerable population, so making sure that our skilled nursing facilities have the required 14 days or more of personal protective equipment, and really the ability of our hospital to be able to have sufficient capacity in case we had a surge of cases. As we increase the capacity for testing, we're going to see numbers increase. I mean, you've seen that over the last few weeks, and particularly ever since we implemented the 2 Optum Serve sites, and then shortly thereafter implemented the free site over at MPC provided by Planned Parenthood Marmonte. So as we increase the availability of testing, we're going to have individuals who are potentially asymptomatic or mildly symptomatic who could not access those services through their normal healthcare channels or through the hospital, now have an opportunity to be able to go and get tested. So we're going to see the increase in numbers. When we start to get concerned is when those numbers then get to, any particular case then needs hospitalization or needs to have access to an ICU bed or needs access to a ventilator. That is really then when we as a public health department begin to get considered if those numbers start to go up, if the number of deaths start to go up, or if we get to a point where, our hospitals are at capacity and may not absorb any surge that may be forthcoming from opening a new sector. So those are really the 2 key indicators that we're going to use to help guide at, do we continue to progress at the level with the state, or do we need to slow down a little?
I think that is so particularly difficult for people in business when they have hired their employees back and they've gotten everything up and running. The thought of having to pull back is really a very severe one. So I think that's one of the things that is prompting people to really do peer advising. When you see someone that who's not wearing a mask, to really come forward and say, where's the mask? I believe that people really need to not just personally patrol, but ensure that those around you are also following the same good guidelines. And one of the other questions that has been asked is that now if we are opening the opportunity for people to travel, leisure travel coming through here, have we gotten rid of the 14-day mandatory quarantine that we were asking people to do when they would come into the state?
So I believe that CDC guidance for anybody that travels outside of the United States upon their return, and I understand even other counties other states. So for example, if you cross the border over to Canada, you are on a mandatory 14-day self-quarantine before you can re-engage. And so the same applies for individuals re-entering our nation.
And if they are coming from Arizona to California, that is not required.
No.
Okay, that's good. And then some sort of random questions. I think people are genuinely concerned about, here it is. What is the number of people allowed for a gathering in Monterey County?
So technically, the state has not permitted gathering of individuals of any size. Having said that, we are developing guidelines to be able to allow social circles to form. There are some counties to the north of us that have developed local guidelines as part of their more recent shelter-in-place order that are very specific to what a cohort is. No more than 12 people. It can be a combination of children and adult for household unit or social support or recreation would be one category that we are developing guidelines for. So this could be that 2 or 3 families, so long as the combined membership is not more than 12, could go to one of those families' homes and hang out outside so that the children can recreate, so that they can enjoy a meal together. And that cohort must stay consistent for 4 weeks. Meaning that they can't introduce a new family if one of those families is not able to attend the next celebration. While they are in those social circles, they don't need to wear face coverings. So some of those rules kind of go out the door again, because of the fact that we're establishing a cohort. It's going to be consistent, and they're doing activities that are outdoors. There's another one that will create a social circle for children for recreation purposes. So this could be where there are 10 children and 1 to 2 adults. So this is where maybe somebody wants to gather the kids from the neighborhood, the same kids every time, and go to the nearby park and have a little soccer scrimmage, etc. Again, it would have to be the same number of individuals that gather consistently over a 4-week course. So we're working on that right now. We understand that there are gatherings. You know, we did see a spike in the number of cases or confirmed cases, you know, a couple weeks after Mother's Day, a couple weeks after Memorial Day. I presume in the next week or 2, we'll start to see increase of number of cases because of individuals and families coming together for graduations, and then Father's Day, and then 4th of July. So at least now individuals will have a better idea of how they can continue to, you know, perhaps engage with another family or friends, but do it in a way that really continues to protect themselves, their family members, and those individuals that they seek to re-engage with socially.
If I could add that, you know, there are specific instances where people can gather. For example, now for religious services, there are restrictions on how many people can be in a building. It's 25% or maximum 100, whichever is lower. If you're going to go dine in at a restaurant with your household, you can obviously sit at the same table. So there are some specific instances where people will be in somewhat close proximity, but they do have to maintain social distancing. And I think tomorrow movie theaters are going to be able to be open with a lot of the same restrictions as well.
Wow.
That's interesting. Here's an interesting question. Is it necessary to screen each client at the door for a fitness studio, as an example? And why are some businesses required to do this, but not all, just such as grocery stores?
So that's a very good question, but it is a requirement in the new state issued guidelines with respect to screening patrons. And it could be that you ask them a few questions and you just take their word based on their response with respect to the symptoms. It could be that you purchased a device to be able to take their temperature without touching them. So that is a requirement of many of the new sectors that are allowed to reopen. I think some of the basis for that could be that when you go into a grocery store, especially the grocery stores implemented a lot of visual cues to kind of keep everybody going in one direction, not really creating an opportunity for people to cross paths in the aisles, floor indicators to show when you are 6 foot, your interaction with the person at the meat counter, your interaction with maybe somebody at the bakery and the deli, and then at the point of checkout are only a few minutes. So it's really kind of a constant movement of individuals. Whereas if you are going to a dine-in restaurant, or now you are going to a yoga studio, you are going to be with those individuals as well as the instructor or anybody who may be serving you far more than a couple of minutes. And really for us, if you are considered, a close contact is considered somebody who is within 6 feet of somebody else for 15 minutes or more. And so I think that's the reason why there are some of those distinctions, because of the prolonged interaction with other individuals that are normally outside of your household unit.
Could I ask a question? I think I have two that may be related. I'm wondering if you can let us know if, in your opinion, and maybe this is Mr. Gerard as well as Ms. Jimenez, that there's anything in particular that estheticians can think about and prepare for. I know there are a lot in our area. They're very interested in getting back to work, and of course a lot of their work is in close proximity and can take some time. So are there any precautions that might be useful for them to really make sure they do, maybe above and beyond what the state recommends? And then maybe an issue for estheticians and maybe for a number of other folks. There's concern that they've been paying their permit fees, that would be within a city, but also some have health department related fees. And if they haven't been able to operate, is there any possibility of some sort of reduction or forgiveness if the fees are, if they're not able to cover their fees because they haven't been able to be in business?
So Les, do you want to start off first?
I'll do my best. I mean, in terms of the estheticians, it would seem to me that it's very much like a massage, nail salon, where there is close physical contact with somebody else. So I assume that the state guidance will actually be pretty thorough with respect to those types of situations. The only thing I can think of is in addition would be, just even more frequent washing your hands using the disinfectant, that type of thing, because of the direct physical contact you're probably going to have with your client. With respect to the fees, I have not heard that question raised before. I know that there are certain circumstances where public entities can waive or suspend fees, and I think if the Board of Supervisors wanted to perhaps ask staff to look at our fees that may be applicable in these situations, we could do that. But each entity that levies a fee for business license fee, for example, in a city, that would be up to each of those local entities to give a credit for some period of the year, or suspend the need to pay the fee or delay the need to pay the fee, forgive penalties, that type of thing.
I think as well, a lot of the smaller businesses have asked questions about where's the help for me. The big state programs through CARES and the PPE programs, the payroll programs, did not fit for small businesses. I mean, not even unemployment insurance would work. But I know that there is a program that is existing within the city of Monterey that I think is important, and I don't know how many people are aware of it, but it is through the Community Foundation. And I believe it is with the city of Monterey, where they are able to provide small loans, $600, $1,000 to businesses to help them get through this difficult time. And I'm hopeful that perhaps our team sitting here putting all of the wonderful things up on our grid might be able to have that contact information available as well. I think there really is a lot of help out there, but it's just difficult to find it. I know my team and I were navigating our own county's website to try to get some answers to questions that we were anticipating for tonight. And even that, where you feel like it should be so easy, and we who use it a lot had to really kind of dig down to find information that we were looking for. I think that's one of the difficult parts, especially when a person is frustrated and they don't know where to go or what to do, and they may not be adept at computer work. So I know one of the other places where a lot of the information is sort of headquartered, in a sense, is at, or aggregated, I should say, is by calling 211. And you can call 211 to be brought up to speed on what the information is, or to be at least talked through with a live person where you can go to find the exact information that you're looking for. And I think from my own personal perspective, when you just cannot find what you're looking for on a website or, you know, within your own sphere of friends, I think trying 211 might be a good way to go to get that kind of information easily from a real human being. So how are we doing with our questions and answers, colleague?
There are lots of questions that keep popping up. Some of them we have addressed to a certain extent. I was trying to focus on the personal services and non-emergency medical. There are a couple of other questions that we can get to if we are feeling like we've answered a lot of those questions. You know, part of the challenge for us here at the county is, and I know a lot of you have this frustration, is, you know, what is the logic behind what is opening and what isn't? And we don't really know. I think, as Mr. Gerard said, it depends if, you know, the association or that certain businesses are aligned with has been able to, you know, pound down the door at the state level, and so it's you know, it can seem a bit arbitrary, and our challenge is we can't go any faster than the state. We can't be more liberal than the state. So if they say certain things are in and certain things are out, it may not make any sense to us, logically speaking, and that's still what we have to deal with. So we're with you in the confusion and frustration. I did want to just ask one of the questions that came up. There's a question about whether schools will be opened soon, and the concern about the fact that, you know, there's no better way to develop your immunity to diseases than being around children. They get everything and they bring it home, and so the petri dish that is the school environment has someone concerned. And then another thing that doesn't make sense is, you know, if gyms are open, you know, when are school sports activities, particularly those played outdoors, going to be able to open? So schools stuff.
So I'll start, and then maybe Mr. Gerard wants to join. So what outdoor and indoor play structures are not permitted to reopen. Again, high touch areas. Who's going to be following the children and wiping down every surface that the child touches as they're climbing the jungle gym or using the swing set, for example. So those are not permitted to reopen, whether they're in a park, whether they're on a campground, etc. Now, schools were added as part of stage 2 for reopening. Last on June 5th as well, the state did release guidelines for reopening of schools. And then subsequent to that, just this Monday, the California Department of Education released their specific guidelines for reopening schools. And so our local superintendents have been meeting regularly with our county superintendent to begin to develop a plan based on CDC that was mentioned previously. A lot of the guidance that is not yet developed at the state level is developed by the Centers for Disease Control and Prevention, and that would be a good guide to go to, as well as to any of your state associations, your licensing board. Many of them are beginning to post some checklists or guidance or things to begin to think about. But having said that, our superintendent of schools, Dr. Dominguez, did provide a presentation to the Board of Supervisors and to the public on Tuesday regarding their tentative plan for how they will reopen schools. Granted, some schools are reopening for summer and are using the plan as currently developed to be able to create a safe environment for the staff that are returning to the school, as well as for the students that are going to be returning. But the way that we know how to access services at school, how our children's experience has been up until prior to the pandemic, is going to be very, very different as schools reopen, because of the fact that the 6-foot physical distance is a critical element. The fact that we need to cohort individuals, meaning form smaller groups up to whatever capacity a classroom may have, as long as you're keeping them 6 feet apart. Face coverings for adults and for children over the age of 13. Minimizing interaction with students from outside of your cohort. You know, the infrastructure at many of our schools just does not lend for every grade level, every classroom, for all of those students to be able to return come August 20th or whenever school starts. So they're talking about creating staggered schedules, meaning maybe certain grades come 2 days a week, and then the other grades at that school come 2 other days of the week, and Friday is to be determined based on the needs. They're talking about potential half days for students. I mean, really a combination of in-person instruction coupled with continued distance learning while these rules are still in place with respect to 6-foot distancing. As you can imagine, a school bus has the capacity to be able to seat 2 children per seat. That is no longer going to be an option. They have to seat the children every other seat and stagger which seat they sit in. Again, these are all things that the schools are looking at right now and determining what modifications they're going to have to make to their bus routes, to their classroom, to all, you know, where they teach their children. It could be that now gyms or even outdoor becomes a classroom so that they can, you know, safely continue instruction as we reopen the school. So I think we need to be prepared mentally that school instruction is going to look very different. So to the extent that we can begin talking to our children about that, the Health Department Behavioral Health Bureau does have sessions, and maybe we can share that link, you know, moving forward, that are specific to parents, to teenagers, to youth. And these are really good forums for members of the community to come together virtually and you know, share our concerns, our fears, our frustrations, and get some good guidance and counseling by licensed therapists. And I think another thing that we as a community need to be prepared for is how are we going to be able to balance these modified school schedules with the fact that most of us work Monday through Friday, 8 to 5. That's another big challenge that our community is going to have to determine how we're going to accommodate our workers to continue to provide their service, knowing that not everybody could work from home, and the lack of availability of potential childcare, who also have a lot of restrictions with respect to group sizes. So this is obviously a big challenge that we as a community are going to be facing, and there are discussions happening with the school districts and hopefully soon with the business sector through some of our efforts with Bright Beginnings, for example, that are hopefully going to be able to convene individuals to begin to look at what this means, so that our children can go back to school safely, but the parents can also continue to earn a living.
Yeah, the only thing I would add is, although the superintendent of schools has been working on guidance and a plan, the decision to reopen will be up to each school district. So and how they open. So you may see one school district decide to remain closed for some reason, and the rules that will apply to each school district and probably each campus may differ. So parents need to stay in touch with their local school district to see what they're going to do.
So thank you for that, Les. And I think that Elsa, you really hit on the frustrations that people are feeling, which is one of the most difficult things for us to have to try to address. I'm going to read a question because I think it really expresses very well the frustrations that people have, and perhaps we could come up with some sort of an answer. How is going to Target or the grocery store filled with 30 to 80 people safer than going to a personal appointment with one person following all the guidelines, even before COVID policies were set in place? I understand you guys don't have all the answers, but why don't you? Why are you satisfied with the answers that you're getting from the state? You guys have the responsibility to help guide us, advocate for us. I know you guys say we should contact the state ourselves, but how are you guys advocating for us? My license requires me to take a bloodborne pathogens test yearly. I comply with all my health department requirements. I pay personal license fees as well as establishment license with the county. So what is my health department doing to let the state know, oh my dear, okay, to let the state know that we practice above and beyond what guidelines, oh dear, I think somebody's fooling around with the screen, so I've lost my question again.
You get the.
Here we go. So, sorry. So what is the health department doing to let the state know we practice above and beyond what guidelines spas and salons have in place? These meetings have been so very disheartening. I feel like it's important for us to try to address that kind of frustration, because I think that, thank you, person who wrote this letter, because I think it sums up what a lot of people are feeling.
We share in that frustration. I think, as Les indicated earlier, the whole reopening plan process was supposed to be to slowly reopen those sectors that were considered lower risk for the spread of COVID-19, create even a lower risk for the spread by implementing modifications. And then all of a sudden, new sectors were added into that. Many health officials across the state of California have also questioned in terms of the reasoning or the decisions that are being made to reopen sectors just don't make sense from a disease prevention perspective, because again, that is kind of what is guiding us. So we are there with you. We advocate through our Health Directors Association, through our Health Officers Association. We send notices to the state health officer and to the state assistant director of health, to the Health and Human Services secretary. And so we are right there with you, advocating for certain sectors to reopen who many health officials across California feel can create lower risk environments with modifications. Know that we are there. And as I mentioned, in the absence of state developing guidelines for social gatherings, many counties, including our own, have taken it upon ourselves to look at what are the modifications we need to put in place so that we can allow small gatherings to begin to happen. So those are, we're supposed to be less restrictive. We can be we can't be more restrictive. We can be more restrictive than the state, but not less restrictive. This is a decision that some health officers are making with respect to, allowing social gatherings to be less restrictive than the state, because we feel that it can be done safely, and again is very important for the well-being and mental well-being of our residents to be able to reconnect in person with loved ones. So we continue to advocate through our channels, and we encourage you as well through your licensing boards or state associations to also advocate with the governor's office, with the Health and Human Services Secretary, Dr. Galley, as well as with the Department of Public Health.
Thank you.
Let
Go
me
ahead.
Let me add that I, from a legal perspective, I completely feel the frustration. I look at some of the decisions the state makes and scratch my head as to the basis for them, not on a health basis, but on a legal basis. And know that the State Association of Counties is very involved in lobbying as well and discussing these issues with the state. So we're in Sacramento as much as we can, trying to get things going.
And I want to thank both Ms. Jimenez and Mr. Gerard, not only for being here, and Mr. Chulos, not only for being here, but for those remarks. And I will just vouch for them and for Dr. Moreno. They are in touch with people at the state level all the time. And when there are issues such as this, they are transmitting that to the state and asking the state to make the kinds of decisions that bring some of these sectors into alignment, instead of it just looks like hopscotching all over the place. So we hear you, and we will advocate for you. And I know that the things that you say, the way you do your businesses, give us confidence that you are ready to open, that you will be responsible. And so I just want to thank everyone for participating. We've come to the end of our time. If we didn't get to your question this evening, we do have them, but feel free to reach out to our offices. We have put the District 4 and District 5 email addresses in the chat. And for those of you who are on the phone and can't see, it's District 4, the number 4, at co.monterey.ca.us, or District 5, the number 5, at co.monterey.ca.us, or you can go to the county website and look for us, Supervisor Parker, Supervisor Adams, and we and our staff will be back in touch with you. And we really appreciate your participation, your preparedness, your willingness to do everything you can to keep yourself and your clients healthy. And it's going to be an ongoing process. We're learning as we go, and really appreciate your full and vocal participation. We're going to need you as we go forward, so please stay involved, stay in touch, be well, be safe, and be kind.
Thank you as well. Thank you, Supervisor Parker, for those great words. And I echo my colleagues' comments. And I simply want to add this, that the simple fact that you participated in this webinar this evening shows that you care. And that's one of the most important steps forward. So I know working together, we have confidence in you that you will do the right things and that you will be able at some point to open your businesses in a very responsible way. And I hope that you'll have confidence in us, that we're trying as best we can with these wonderful people that we are lucky enough to work with, to be able to advocate for you so that we can get your businesses, your employees, your families up safe and running well. So
Soon.
thank you again. Soon. Thank you again. Thank you very much for working on this so well, all of you. Thanks.
Thank
Bye-bye.
you.